So I'm going to dive right in. OhioRISE, the RISE in OhioRISE stands for Resilience Through Integrated Systems and Excellence. And we're going to provide an overview of our program today. And when we think about OhioRISE, we're really trying to integrate care for youth that serves these kids across the systems. So OhioRISE is a brand new program. It launched last July of 2022, and it serves youth with complex behavioral health and multi-system needs. So they can have co-occurring disorders and be involved with the developmental disability system as well. One of our objectives is to prevent custody relinquishment and better serve multi-system youth. We've all heard stories over the past few decades about families who have to relinquish custody to their child protection agency in their county because they're trying to access costly services. Usually, those are placement services out of the home. And so we really want to prevent that through the Ohio Rice program. And we also call these kids and youth multi-system youth because they're usually involved in multiple systems. So the behavioral health system, the developmental disability system, maybe the justice system, and the child protection system are just to name a few. And so the way that we want to really help these kids and these youth are by adding more intensive in-home and community-based services and supports. Um, our Ohio Rise model uses high fidelity wraparound approaches and principles. And so, through that model of care coordination, we're really trying to make sure that everything that we're doing puts the family and the youth at the center of their care. And we want to make sure that we're listening to all of their needs and the things that they want out of their health care and out of all of the things that their family might be in need of across their community. So making sure that we're prioritizing their voice and their choice, because we know that if they are actually listened to, they'll stay more engaged with their treatment and have better health outcomes. We also have been designing and developing Ohio Rise since it's such a brand new program with stakeholders. So we have stakeholders from across the state that are from all of the different systems that these youth are involved with because we really want to make sure Ohio Rise is a successful program. And that's another reason why we're here today with you all because we want to hear feedback. We are being transparent. We want to tell you about the program. We want to hear how it's going on the ground, and we want to be accountable and make any changes and improvements to the design of the program. And then we are also using a shared governance model. So, one of the reasons why we're invited here today is because we've worked closely with the Department of Developmental Disabilities and other sister state agencies to make sure that we're designing a program that can be implemented across their systems and through their initiatives that they're lifting up as well. So I talked about the objectives of Ohio Rise, which is to serve youth with complex behavioral health needs and multi-system needs. And I want to talk to you a little bit about the services in the program. So this is our wheel of services, if you will. And if you start over on the left-hand side at the bottom, these youth that are enrolled in the program, they have access to all of their existing behavioral health care services that they get today. um, but now Aetna Better Health of Ohio, which is the Ohio Rise Managed Care Plan, would cover those services, all of their behavioral health services. And their physical health care services will be covered by either fee for service or their managed care plan. Um, Youth in Ohio Rise, and not just youth in this program, but also that are in Medicaid, have access to a crisis service called MRSS, or Mobile Response Stabilization Service. So this service is brand new. It was something that was grant funded in just a few counties across the state, and now it's growing to about half the counties across the state. And this service is, again, it's a crisis service where if a youth and a family are experiencing some kind of a crisis, they can call the MRSS line and a team will come out and they'll de escalate the situation. And then they will see if that kid and that youth and that family, if they're eligible for the Ohio Rice program. And then they will also link them to other services for the next 6 weeks. And again, that's covered not just by OhioRISE, but also by managed care and in fee for service. Youth in this program are assigned a level of care coordination based on their needs, and that's limited, moderate, or intensive care coordination. And I have some future slides that I'll get into that in more detail. And then there's also IHBT or intensive home-based treatment. And this is a service that's very intensive. It's provided in the community, usually the home setting. It takes place several times a week in the home, and it helps to improve daily behavioral health functioning. And then there's also a new residential facility called Psychiatric Residential Treatment Facility, which is an inpatient level of care. And right now, PRTFs are only available out of state. And so this would be the first time that Ohio will have PRTFs in the OhioRISE program. And so we've been working with again, with our other partner agencies like the Department of Mental Health and Addiction Services, who will help us launch this later on this year. So we're really excited to have PRTFs in the state. This will be a new service that will keep families closer together so that their youth won't be out of state. And it will help that when the child is actually transitioning back home and into the community, it will it will help them be closer to other services so those services can be wrapped around that family and that youth for more support. And then we have some additional services that are available to youth in the program, and that's behavioral health respite. So this is a community respite service that helps caregivers and families have a needed break. And then we also have primary flexible funds at $1,500 within a 365-day period that can pay for things that can help that youth integrate better into the community or keep that family and youth together and safe in the community. And then we also have a waiver. It's called a 1915C home and community based waiver on top of the Ohio Rice program that I've been talking about. And this waiver has its own unique waiver services, which are listed here, and it also has certain eligibility criteria. So I wanted to make sure to flash this slide in front of everyone. I talked a little bit about it in the last slide about services, and how youth have access to all of their existing behavioral health care services, but that's provided through Aetna. And then all their physical health care services are provided by their current managed care plan or fee for service. So what I really wanted to drive home was that essentially when a youth is enrolled into Ohio Rise, they have two managed care plans or they have two health plans. So they would have Aetna Better Health of Ohio for behavioral health care, and then they would have Medicaid managed care or fee for service for their physical or medical health care. And then just for any of the providers that have joined us today, if you're billing, you want to bill the current Medicaid managed care plan for their physical and medical health care services, such as applied behavioral analysis or ABA therapy, and only bill the Ohio Rise plan, Aetna, for any behavioral health care services. So I've talked about the goals and the aims for the program. I've talked about services, and now I'd like to just talk a little bit about who's eligible. So youth have to be 0 through 20 at the time of enrollment. So we do serve youth all the way up through 20 years old. Um, and they have to be Medicaid eligible, so either in fee for service or in managed care currently. They can also already have an existing 1915C waiver through the Department of Developmental Disabilities, but they have to require, this is the key, they have to require significant and intensive behavioral health treatment needs. And that's determined by an assessment that we have called the Child and Adolescent Needs and Strengths, or the CANS assessment. There are two additional ways that youth can get enrolled into the program, and that's through an inpatient stay in a hospital for mental illness or substance use disorder as their primary diagnosis, or if they have an inpatient stay in one of those out of state psychiatric residential treatment facilities. So just a little bit more about the CANS assessment. So again, youth who are eligible for the program, they have to have a CANS assessment done to see what their needs are. And so the CANS assessment is a functional assessment tool that looks at the whole picture of what's going on in that family. So it doesn't just look at the youth, it also looks at the caregiver, and it looks at their needs to build upon those and fill in any gaps, and then also their strengths. And then it provides a decision support to identify any long-term care that they need. And when I say a decision support, I think we're really talking about here what level of care coordination they're going to need. And so I mentioned that earlier, and again, we'll get into that in a few more slides. But over on the right, it's number 3. It recommends a tier of care coordination. So again, youth can be assigned to limited care coordination, moderate, or intensive based on their needs. And then again, it determines eligibility into OhioRISE, and then it's used in an ongoing way for care planning. So, depending on which care coordination level they're in, they will have a CANS performed every 30 days, 60 days, or 90 days to see if maybe they've improved and they need less services, or if they haven't improved, maybe they need a little bit more help and wraparound support. So, I've talked a little bit about all of the program as far as eligibility and services and the goals. And now I'm going to talk about another pillar of the program, which is called care coordination that's delivered by our care management entities. So, what is a care management entity? A care management entity is really a new layer into our treatment system. And these are really a go-to place for youth and families in OhioRISE, but it's also a go-to place for our providers in various systems, as well as other community partners, so that all of these youth who are involved in multiple systems have one place to go. They have two primary responsibilities, and that's delivering care coordination using wraparound approaches, and also developing the system of care and making sure that they understand what's around their geographic area that they're in to make sure that they're linking youth and families to different providers and to other community partners so that all of their needs are getting met. So I really wanted to show you what care coordination looks like using high fidelity wraparound, that national model that our program is also using the principles to support care coordination for families and youth in OhioRISE. So if you look at that circle, again, we're always about putting the family and the youth at the center and prioritizing their needs and their voice and choice. And then through talking with that family and using that CANS assessment, we find out what other systems they're involved with. So, do they have an SSA by chance? Are they involved with the developmental disability system? Maybe they have a caseworker at the child protection agency that they're in their county. Maybe they have an IEP teacher, or maybe they're involved with a primary care doctor. So they can also talk to us about people in their life, any natural supports that are really important to them and that help them be successful. So they could have a grandparent or an uncle or an aunt or maybe a coach, for example, who they say, this person would really go a long way with helping us as a family stay well. And so they would all come together and they would become a team, and we call it the child and family team, and this way, the family isn't navigating across all of these systems and trying to make sure that they're having meetings with all of these different systems and telling the different systems about what's been going on in their other meetings. Instead, everybody would start to coordinate and discuss things that are happening in that youth's life, and maybe even reducing the number of meetings that the family is having because they can all meet together and reduce those number of meetings. And so really the child and family team is the purpose is to come together, talk and communicate, coordinate things so that there's really one plan of care for that family. So Ohio Rise is really trying to offer more resources to other partner systems, including the developmental disability system. It offers a team for the SSAs, direct service providers, behavioral support specialists, and all of our community partners to not feel alone so that we can all help families and be supportive of families. We wanted you to know a few more facts about Ohio Rise care coordination. So, care coordinators can help youth and families who are not able to get access to service and support administrators if they aren't, or if they are eligible for OhioRISE. So, if a youth is found not eligible for county board services, you can direct that youth with those complex behavioral health needs and developmental needs to the OhioRISE program to get a CANS assessment to determine OhioRISE eligibility. Another couple of facts, care coordinators bring together other system partners, such as behavioral health providers, you remember in that circle, to assist youth and families with their needs so that SSAs and others don't have to become experts in other systems. These care coordinators can help do that and fill that divide, especially in the behavioral health world. And care coordinators can also work with the youth's managed care plan to find providers needed to support the youth, including services like ABA therapy that are covered by the managed care plan. So these managed care partners work really closely with OhioRISE care coordinators, and they can be a part of that child and family team that we just looked at on the last slide. So, a little bit more about tiers of care coordination. So, when a youth is assigned to Ohio Rise, they're also assigned to a tier of care coordination. So, there's three tiers. Tier one, limited care coordination. This is delivered by Aetna, the Ohio Rise plan. And these are for members and families who have lower intensity care coordination needs. Or they can also opt out of tier two or tier three and decide as a family that they only want limited care coordination. And then there's tiers two and three, moderate care coordination and intensive care coordination. And these are delivered by those care management entities that are that go to place for families and providers and community partners. One of the differences between the different levels of care coordination is the frequency of meetings and just really trying to make innovative and customizations of the different plans between tiers one, two, and three. Something we did want to call out is that this is all about being a complementary process between other systems. Ohio Rise Care Coordination honors the mandates of other systems. We know that you have certain requirements and obligations that you have to fulfill, just like our other system partners that we work alongside. And so we want to support what you're doing and enhance what currently exists. This is really all about multiple systems that are coming together and trying to create one path for that youth and family to be successful. All right, so how do you refer a youth to the Ohio Rice program? Those care management entities are really a great resource. These are the geographic areas that our care management entities serve in across the state. So there's 20 different catchment areas. And as you can see, many of these care management entities serve multiple counties, but for our more metropolitan areas like Cuyahoga, Franklin, and Hamilton, there's more than one care management entity in those areas. So if you are in a certain county, I'll go back for just a second. Say you're in Tuscarawas County. So you're over here in this blue area. You would go to the chart, you would find yourself over here. Your care management entity is Jefferson County Educational Service Center. And this is all located on our website, and you'll get these slides afterwards too. So then you would find Jefferson here, and they actually have a portal where you can fill out a form to get to refer youth to get a CANS assessment to determine Ohio Rise eligibility, or you can just directly email them, or you can just call one of their phone numbers and get connected and refer youth to the Ohio Rise program. Now, if you're in Cuyahoga County or Hamilton, and there's more than one care management entity, you would need to look up the zip code of that youth and where that youth resides. So, for example, in Cuyahoga County, if they're in 44022, that is the east side of Cuyahoga County, you would just come back to Cuyahoga County. You know that there's right here, Cuyahoga County listed here. There's west, central, and east. And we said that that was east. So this would be Ravenwood Health. And then again, find them here and then you can email or call them. And then for Franklin County, I just put a note. It doesn't matter which zip code they're in, even though there's more than one care management entity, because all referrals are directed to the Buckeye Ranch. Additionally, you can refer a youth for an OhioRISE assessment to any of their current managed care plans. So if they're with Anthem, Blue Cross, and Blue Shield, or CareSource, for example, you can refer that family to call their managed care organization, listen to the prompts, and get that CANS assessment scheduled that way. They could also, if they're in fee for service, call the Medicaid consumer hotline, or they can also reach directly out to Aetna, the OhioRISE plan, at their member services contact line. And then these folks at Aetna, the OhioRISE plan, are wonderful, and you can reach out to them with any questions that you have regarding the plan, regarding a youth enrolled in OhioRISE, or just to get connected to your care management entity. These folks have great relationships with the care management entities. Even if you're thinking like, I need to do a community event and I'd like some support from OhioRISE, these are the folks that you'd want to go to. Any and all questions you can direct to these regional coordinators at Aetna. And you can see that each of them have a certain area of the state. So Laura Mann has Northeast Ohio in blue. Frank has Central and Southeast in green. And then Nick Miller is the Western region. And also Nick Miller has a long history in the developmental disability system. So now I'm going to turn it over to my colleague, Katie Courier, and she's going to talk about some of the behavioral health services in our program.
Thanks, Kelly. My name is Katie Courier. I work in the Policy and Program Development section in OhioRISE. And prior to my role here, I was an SSA at Franklin County Board of DD for about 7.5 years. And then just prior to that, I was at DODD working on implementing the self waiver for about 2.5 years there. Okay, so the first service I'm going to go over is the OhioRISE Behavioral Health Respite Service. This service is actually very similar to DODD's Community Respite Service, where it offers short-term relief to the primary caregiver to help maintain and support that relationship between the youth and the caregiver. This could be like a planned weekend respite away, or if you know the caregiver might be going on a vacation, it's that type of respite relief. Next slide, Kelly, please. Thank you. Um, so this chart is a really helpful tool to compare the types of respite on the DoDD side of things to the Ohio Rise side. So you can see here that any provider that is certified, let's say, to provide community respite, also likely has the certifications able to provide behavioral health respite through or out of home respite through the Ohio Rise program. Um, and so if you have an individual who's receiving community respite and they're also enrolled in the Ohio Rise program, you could look into if that provider is willing and interested in enrolling with Medicaid, since they already most likely have those certifications. They can just enroll to become a behavioral health respite provider through Medicaid too. So this is just kind of a handy tool to cross compare those DoDD respites to the Ohio Rise respites. Next slide, please. Okay, next we'll be going over the OhioRISE Flex Funds service. Next slide, please. The Flex Fund service, this service, if you want to compare to something, is likely similar to the DoDD service, participant goods and services, or like an adaptive assistive equipment or environmental home modifications, where the youth is able to purchase services, equipment, or supplies that are not provided through any other vendor or higher rise or Medicaid state plan. And these are provided to address their behavioral health concerns. Next slide, please. In this chart, well, I'll be going over secondary flex funds through the OhioRISE waiver in a few slides, but this chart kind of compares the two different flex fund service. So we have primary flex funds, which is available to the youth enrolled into the general OhioRISE program. And that cap is about 15, or not is about, is 1,500 per calendar year. And if you cross compare it for the secondary flex funds, which is available to the high rise, the individuals that are enrolled into the high rise waiver program, that they have the cap of $3,000 per 365 days. And so it's important to know if someone is enrolled onto the waiver, they have to exhaust their primary flex funds before they can access their secondary flex funds. And for those that are enrolled into the high-rise waiver as well, they have the option of the emergency funding, which is $2,000 per calendar year. And again, if they're enrolled into the waiver, they have to first exhaust that primary flex funds and then exhaust the secondary, and then they'll have access to that emergency funding. Next slide, please, Kelly. Thank you. So next we'll be going over the OhioRISE 1915C waiver. Next slide, please. So the first thing I want to call out is that since we're at a DoDD behavior support workshop, I know there's a lot of individuals on your caseload that are on either level 1 IO or self waiver, which is another state of Ohio 1915C waiver. So I just want to note that you can't be enrolled into 1915C waivers at the same time. So those that are eligible to enroll on the OhioRISE waiver, let's say they get they let you know that you're eligible to be on the OhioRISE waiver, but you're also on a DoDD waiver. It's really important to kind of compare that individual against the services offered that I'll go over next in the OhioRISE waiver. So, for example, if someone has 24/7 homemaker personal care, it might not make sense for them to enroll into the OhioRISE waiver just because the waiver itself, it doesn't offer that kind of support. It's more for those behavioral health concerns. But that being said, someone who is enrolled on a DoDD waiver, they still are able to enroll into the general OhioRISE program. So they can have all those DoDD waiver services and then enroll into the OhioRISE general program and have all the benefits offered through that as well. Next slide, please. So a little overview of the waiver. Ohio Department of Medicaid holds a responsibility for determining the eligibility of the youth on the OhioRISE waiver. Um, and next, those care management entities that Kelly went over, those are only that organization is able to gather the clinical and functional information needed to assist the Department of Medicaid in making a waiver level of care determination. Um, so, so the care management entities are the only agency responsible and able to collect any information for someone who might enroll onto the waiver. Next slide, please, Kelly. So OhioRISE waiver eligibility and enrollment. So in order to meet the waiver eligibility, you first need to meet the eligibility requirements associated with the general OhioRISE program. And then on top of that, you need to have a diagnosis of serious emotional disturbance. You have to have a qualifying inpatient psychiatric level of care. You have to be at the age of 20 or younger at the time of enrollment. And then once you are enrolled onto the high-rise waiver, you are able to remain enrolled until the age of through the age of 22. You must use care coordination, either tiers 1, 2, or 3. Next slide, please, Kelly. So now I'm going to go through the OhioRISE waiver services. We have 3 services offered in the OhioRISE waiver. The first one that I'm going to go over is out-of-home respite. So out-of-home respite is a waiver service provided to youth enrolled onto the OhioRISE waiver that are unable to care for themselves. This is an additional respite service that is offered to youth enrolled on the OhioRISE waiver. And This is only the behavioral health respite that I went over earlier is available to everyone in the general OhioRISE program, but this one is specific to waiver individuals. Next slide, please, Kelly. So, a high-rise waiver transitional services and supports is the second service that I'll be going over. This service is designed to provide family stability and supports for youth, their primary caregiver, and family as a pathway to creating a stable environment in the home. It is meant to be supports for individuals and their families to help them understand and address behavior inducing situations and provide them with the connections or solutions to address those behavioral concerns. This service is intended to be an additive support for the youth that might be transitioning, from example, maybe from a hospital back into the family home, or someone who might be leaving one foster care home and entering another, and providing and understanding the supports that are needed for that youth and what can be a very intense time. Next slide, please, Kelly. Okay, so the last waiver service is secondary flex funds, and I briefly touched on this earlier. This service is similar to the DoDD services that I went over, but they're able to provide services as equipments or supplies that are not otherwise provided through OhioRISE or through the Medicaid state plan that are designed to meet a need of the youth in order to address their behaviors. Next slide, please, Kelly. So the secondary flex funds again cannot be used until the primary flex funds have been exhausted that is available through the general OhioRISE program. The cap to secondary flex funds is $3,000 in a calendar year. The secondary flex funds also has an emergency fund allotment of $2,000 that is separate from the 3,000, and that is available only after the primary and secondary have been exhausted. And again, the emergency flex funds, there is a cap of $15,000 in the OhioRISE waiver, and that $2,000 emergency flex fund is outside of that. And one last thing to note is that the individual can exercise their budget authority for this service. They can determine the amount of their budget that they want spent on whatever goods and services that they want, while staying within that limitation. Next slide, please, Kelly. Okay, and I think I'm handing it back to you.
Yep. All right, this is our last section, so we'll be wrapping things up. I want to talk about the implementation of OhioRISE since we launched last July. So we have almost 22,000 youth enrolled into the program to date. And again, the way that we determine OhioRISE eligibility is through getting that CANS assessment done. And so long before the launch of the program, we started working on getting CANS assessors certified and registered into our CANS IT system at Medicaid. And so we have over 2,600, almost 2,700 CANS assessors that can perform those assessments and determine OhioRISE eligibility. When we look at data in our CANS IT system, we were able to pull how many youth of those 22,000 have developmental or intellectual needs that's determined through the CANS assessment. And so if you take a look at the pie chart, 64% of those enrollees show no evidence or need of any developmental or intellectual needs. However, 16% do have a history of or some possible need. 14% that's impacting their functioning, and 6% have a need that is dangerous or disabling. So I just thought that we would show you this metric so that you were aware of some of the multiple systems that these youth are involved in of our enrollees in the program thus far. And I wanted to share a couple of success stories because these are what really bring it to life, how the program is working with youth that are being served in OhioRISE and across different systems. So there was a 4-year-old who was presenting with high risk safety concerns, and they came to OhioRISE with sensory sensitivity symptoms and no formal diagnosis. Once they were enrolled with OhioRISE, the OhioRISE care coordinator was able to get that youth diagnosed with autism spectrum disorder and immediately began receiving the appropriate, so that youth began receiving the appropriate care. And with enrollment and an official diagnosis, the family was able to take advantage of clinical supports to properly address the child's sensory issues. The mom utilized flexible funds that Katie talked about, that helps families afford unique community supports that aren't usually covered through other health programs such as Medicaid. And we were able to help them purchase different sensory items, different toys, and other products for a room at their house. And while this addition of items to the family's home decreased safety concerns, it also provided the child an immediate sense of relief and joy. And the child was so excited to show their care coordinator who came to visit their new room and all of the different things in their room that they didn't want the care coordinator to leave. And according to, oh, we already know this part. So, we're really excited to share this kind of story with you all to bring to life how Ohio Rise Care Coordination can help support youth that aren't just experiencing behavioral health needs, but also other system needs. And here's another story that we wanted to share. So, this child was already enrolled in Ohio Rise, and they were living in a foster home and attending a school for youth with behavioral health challenges. And they were actually in jeopardy of receiving a 30-day notice to vacate their foster home due to increasingly violent and disruptive behavior at the home and at the school. So, this child had only been assigned to Tier 1 limited care coordination through Aetna, and because that 30-day notice to vacate the foster home and all of the challenges that were starting to surface, that care coordinator at Aetna decided that maybe this child needed evaluated for developmental disability needs. And they also got the child a new CANS assessment, because remember that CANS assessment not only determines Ohio Rise eligibility initially, but it's used ongoing to decide other level of care planning needs. So after the CANS assessment was conducted again, a new iteration of it, the child's needs were determined to require a higher level of care coordination. And so they were assigned to Tier 2, and they were now placed with a local care management entity. And so that care management entity scheduled a child and family team meeting, and they met that same day. And the care coordinator at the care management entity was able to educate the youth's foster parent on services available to support them, including behavioral health respite and intensive home based treatment. And during that child and family team meeting, additional needs were identified and plans were made to connect the youth to suitable resources. And so after all of that happened and everything came together, the youth's foster parent felt relieved and excited to have a strong child and family team behind her and supporting them, and was willing to continue fostering the child. So we're really excited that that family stayed together. So wrapping everything up, how does Ohio Rise support youth involved in multiple systems? So this kind of just talks through what OhioRISE really is all about. It's new services or services that were already covered by Medicaid, but they've been enhanced through the OhioRISE program, and they're now Medicaid billable, such as the care coordination component, intensive home-based treatment, mobile response stabilization, respite, and flexible funds. And then care coordination is really a pillar of the Ohio Rise program. And we wanted to make sure that we had this component that was consistent across the state, so that no matter where a child or a youth lives, they get access to care coordination the same. And then the Ohio Rise services and supports are really about being community based and helping to keep families together and not in need of out of home placements. And then OhioRISE care coordination is all about working together across systems and building the system of care for youth and families. So that concludes the OhioRISE presentation. And I think I'll turn it back over to Heather so she can moderate any questions.